I can't breathe. So what you all just saw was a patient experiencing a PE, also known as a pulmonary embolism. PE refers to the obstruction of the pulmonary artery or one of its branches by a thrombus or thrombi that originates somewhere in the venous system or by the right side of the heart. Basically, it is when a clot or clots form somewhere in the body, then breaks loose and travels to the arteries in the lungs and blocks them. Pulmonary embolism is an important cause of morbidity and mortality, with more than 100,000 U.S. cases annually and as many as 25% of the patients presenting with sudden death. PE may be lethal in the acute phase or lead to chronic disease and disability, but it is often preventable.
Our patient is experiencing difficulty breathing, chest pain, anxiety, fever, and rapid heart rate.
More symptoms our patient is experiencing are apprehension, cough, profuse sweating, coughing out blood, and lost consciousness.
And those symptoms can mimic a heart attack, heart failure, and bronchopneumonia.
So yeah, all those symptoms point to a pulmonary embolism, but just to make sure, let's order a few diagnostic tests first. I want a chest x-ray. I need an ECG. I also need an O2 sat if you guys can get that. Draw some ABGs for me, and then let's also get a ventilation perfusion scan and a pulmonary angiogram, a CT, and a D-dimer just to be sure. Alright guys, so Dennis had a massive pulmonary embolism. As confirmed by the test that I had you guys run, this is a life-threatening emergency, and we're going to do everything we can to stabilize his cardiopulmonary status. So the oxygen that you had put on him earlier, we went on ahead and discontinued that, and we put him on an ET tube to support his ventilation and oxygen needs. We also need to get a IV line started, and then we're going to put the patient on some vasopressors, some anticoagulants, and thrombolytic therapy. We're also going to need some CBCs drawn and some serum electrolytes, and I'm going to have this patient get some DVT stockings. And then if these interventions prove unsuccessful, we may have to fix this problem with surgery. So thank you.
So let's talk about the nursing management of pulmonary embolism. We're going to start off with physical needs. We need to be concerned with pain management, oxygen administration, care of surgical site if there is one, monitor for complications, monitoring thrombolytic activities, prevention of further emboli by using stockings, and making sure the patient isn't in any dependent position. Next are our psychosocial needs. We want to encourage the patient to talk about their feelings of anxiety and also to talk with their family as well. This is a life-threatening disease process, and it is important to address their concerns.
And we are going to talk about spiritual needs. It's important to encourage a patient's sense of help, address their quality of life, and any religious concerns they can have. And finally, we are going to talk about health teaching needs. It's important to encourage self-care and prevent future pulmonary embolisms, and it's even more important to have your patient adhere to the prescribed management and prevention of PE. Hello Dennis, you're going home today. How are you feeling?
Hello, I feel much more better.
That's good. So we're going to run through some health resources with you right now, and if at any time you experience any symptoms of PE, you should call 911 and your healthcare provider immediately.
And pulmonologists and cardiologists are great resources to go to if you have any extra questions.
And the American Thoracic Society has a lot of information about PE, and they present it in a very understandable way. Do you have any questions?
No, thanks a lot for helping, guys. You saved my life.